Hello and welcome. In this video, we will talk about infections. Infections are a very important topic for pharmacy, nursing, and public health students. You will meet patients, give medicines, and help communities stay healthy. So, let's learn about the types, causes, modes of transmission, prevention, and treatment of infections. I will use simple, clear language to help you understand. 1. Types and causes of infections. First, what is an infection? An infection happens when a tiny living thing, called a pathogen, enters your body and causes harm. There are 4 main types of pathogens: bacteria, viruses, fungi, and parasites. Bacteria are single-celled organisms. Some are helpful, but others cause diseases like strep throat or urinary tract infections. Viruses are smaller than bacteria. They need a living cell to multiply. Examples are the flu, COVID-19, and HIV. Fungi include molds and yeasts. They can cause skin infections like athlete's foot or lung infections in people with weak immune systems. Parasites live on or inside another living thing. Examples are malaria, caused by a parasite carried by mosquitoes, and intestinal worms. So, different types of pathogens cause different infections. 2. Modes of transmission. Now, how do infections spread from one person to another? This is called transmission. There are several ways. 1. Direct contact, touching an infected person like shaking hands or kissing. 2. Indirect contact, touching a surface that has the pathogen, like a doorknob or a medical instrument. 3. Droplet transmission. When a sick person coughs or sneezes, small droplets go into the air. If you breathe them in, you can get sick. 4. Airborne transmission. Very tiny particles stay in the air for a long time. You can breathe them in even if the sick person is not nearby. For example, tuberculosis. 5. Vector-borne transmission. An animal or insect carries the pathogen. For example, mosquitoes carry malaria and ticks carry Lyme disease. Understanding transmission helps nurses, pharmacists, and public health workers stop the spread. 3. Prevention. Prevention means stopping infections before they start. Here are key methods. Hand hygiene. Wash your hands with soap and water, or use alcohol-based hand rub. This is the most important way to prevent infection. Personal protective equipment, PPE. Gloves, masks, gowns, and eye protection. Healthcare workers use PPE to protect themselves and patients. Vaccination. Vaccines train your immune system to fight specific pathogens. They prevent many serious infections like measles, hepatitis, and influenza. Safe food and water. Cook food well and drink clean water to prevent infections like salmonella or cholera. Isolation. Keeping sick people away from healthy people, especially for very contagious diseases. Vector control. Using mosquito nets or insect repellent to prevent malaria and other vector-borne diseases. Public health workers also teach communities about these prevention methods. 4. Treatment. Curious. What if someone gets an infection? Treatment. What if someone gets an infection? Treatment depends on the type of pathogen. Bacterial infections are treated with antibiotics. But be careful. Overusing antibiotics can cause resistance, which means the bacteria no longer respond to the medicine. Pharmacists help make sure antibiotics are used correctly. Viral infections are harder to treat. Some viruses have antiviral drugs, for example for HIV, herpes, or influenza. For many viral infections, rest, fluids, and fever reducers help the body fight the virus on its own. Fungal infections are treated with antifungal medicines, like creams for skin infections or pills for serious infections. Parasitic infections are treated with antiparasitic drugs. For example, malaria is treated with specific medicines like artemisinin. Nurses give these medicines and monitor patients. Pharmacists check for correct doses and side effects. Public health workers track which treatments are working in the community. 5. To summarize, infections are caused by bacteria, viruses, fungi, or parasites. They spread through contact, droplets, air, or vectors. We can prevent them with hand hygiene, PPE, vaccines, and clean environments. Treatment depends on the type of pathogen, antibiotics for bacteria, antivirals for viruses, and so on. Understanding these concepts will help you in your future work in pharmacy, nursing, or public health. Thank you for watching.
After watching, test your understanding by answering these questions. Question 1. What are the 4 main types of pathogens mentioned in the video? Give one example of a disease caused by each type. Question 2. Describe 3 different modes of transmission for infections and explain how they differ from each other. Question 3. Why is hand hygiene considered the most important method of infection prevention? List 2 other prevention methods mentioned in the video. Question 4. Why should antibiotics be used carefully? What role does a pharmacist play in treating bacterial infections? Question 5. Explain why treatment for viral infections is different from treatment for bacterial infections. Give one example of a viral infection and how it is treated. Question 6. Imagine you are a public health worker in a community where malaria is common. Based on the video, what prevention methods would you recommend to the community, and why?
Great job finishing the questions. To take your learning one step further, review the academic reference listed below. This resource was chosen to support your ESP studies and to give you reliable, evidence-based information that you can use in your future work as a medical, nursing, or pharmacy professional.
This video was created using artificial intelligence for educational purposes only. It is not a real recording, and any resemblance to actual persons or events is coincidental. Some images are purposely used with consent. The content is intended solely as a learning resource.
Practice is the key to mastery. Every effort, no matter how small, gets you closer to perfection. Keep going. Your dedication will pay off. Latihan adalah kunci menuju penguasaan keterampilan berbahasa. Setiap usaha, sekecil apapun, membawa Anda lebih dekat ke kesempurnaan. Teruslah maju, dedikasi Anda akan membuahkan hasil. Salam dari Pak Budi.